Welcome back. July marks World Infertility Awareness Month. Infertility affects millions of people worldwide, but is often misunderstood. It's estimated that 1 in 6 adults suffer from it. While it has been thought as a condition that mostly affects women, many men are also affected. Couples experience the struggle that affects their relationships, and for a discussion on this, we are now joined by Dr. Lusanda Shimange-Matsose. Doc, a very good evening to you. Thank you so much for your time. Perhaps let's begin with you just unpacking some of those common causes of infertility in both men and women.
Evening, how are you?
We're well, thanks, Doc. Thank you for joining us.
Thank you. So when you think about infertility, there's the textbook definition, and then there's the actual, when I say the actual definition. So when you look at the textbook definition, we are basically looking at a couple that is trying to conceive with regular sexual intercourse after a year. And we're thinking about a couple that is less than 35 years old. And then we have a couple that is trying to conceive with regular sexual intercourse after the age of 35 and without a pregnancy. And then we need to go a lot further into say, and I'm really cautious to say less than 35, above 35. I always say to my patients, if you're trying to conceive, it's better to actually see if you are able to, or if you've got an issue or not, sooner rather than later, because it's very common where we get couples who are trying to conceive for more than 5 years, more than 10 years. So I think that is really something that we have to bear in mind while talking about infertility, when there is a textbook definition and there is really something where go and get checked out if you are trying to conceive to see if there is an issue or not.
So then, Doc, do you think there's a common understanding of what infertility is, and has it evolved over time? Are people understanding it more and more? Because there was a time when we consider infertility, we only look at it being an issue that is faced by the females within a couple setting.
I think we're still a bit slow on the uptake in terms of whether we've evolved or not, because there's still a misunderstanding that it is a female problem. And I think we really need to shift the narrative with regards to that and see it as a couple problem and not necessarily a female problem, because we do have male factor infertility and we do have female factor infertility. But ultimately, it is a couple problem and not necessarily one or the other. We have couples coming into our clinic at Medfem Fertility where it could be possibly the male who has an issue or who has the female who has an issue. But ultimately, we are dealing with a couple as a whole. So I think we need to shift the narrative and say it's not necessarily the female, but it's the couple that is struggling to fall pregnant. Of course, the exceptions in that regard, where you have a single person who wishes to be a parent, then that's a different story in all its entirety. But generally, it's a couple problem.
And beyond the gender, Doc, if you were to expand who this is more prone to, are there any commonalities in terms of regions, in terms of race? Are you finding that there are certain factors that are more common than not in certain aspects?
Well, I wouldn't really hone in on a specific region or a specific demographic per se, because we know that infertility really affects 1 in 6 couples, and there's different causes of infertility. So you would have what we call, if we look at both female and male, let's just take the male, for instance. I actually want to start with the male. It could be something like an anatomical factor. So there's actually a blockage in terms of the ability where the sperm is being deposited into the woman's female genital tract. Or it could be a pathological problem or a chromosomal problem. In other words, a genetic problem that renders the male infertile, such as something where, let's just say, if someone has a condition known as cystic fibrosis. So that is a genetic problem that could render a male infertile, or a blockage where the male just actually has no sperm, and we call that azoospermia. So that is not specific to a region or a certain demographic. It's just something that really happens. And then when we look at the female, we have to look at physiological factors, we have to look at pathological factors, and we have to look at anatomical factors. So those factors, I beg your pardon. So those are structural factors. So a common one that could possibly resonate with the viewers is something such as polycystic ovarian syndrome or endometriosis. Those are common factors, pathological factors that could render a woman to have infertility. In terms of structural factors, we speak about tubal factor infertility. So where the blocks are the tubes are blocked, where the tubes are blocked. So the sperm is unable to actually pass through the tubes to get to the egg, to fertilize the egg, and then bring the fertilized egg back into the womb. And then something that's congenital, where a woman's actually born without a uterus, so a womb. So obviously that woman is unable to fall pregnant. So it's not really specific to a demographic or a specific population per se, but it's just really about finding out exactly what is the issue that's causing infertility. And that's why I say, as much as there is the textbook definition, but if you are a couple who is planning to fall pregnant, just really going to go for a checkup to see will you have an issue or not is really something that I would highly recommend.
So, Doc, can infertility occur after a birth? Can a man have a child with someone, then later on in life get married to somebody else, and then only experience infertility? And if such cases do exist, what happens? What's the cause of such?
That is a great question, and thank you for bringing that up. So going further onto the definition, where you get primary infertility and you get secondary infertility. Primary infertility is that couple or that individual that's never been pregnant before, whereas secondary infertility is someone who has been pregnant before, but then come the second time they having difficulty in falling pregnant. So that definitely can happen, and things change. I mean, if you've had a baby when you are 25 and now you are, let's just say 35, things have changed along the way that could render you infertile, such as it could be, like I said, structural problems or pathological problems. So that definitely does happen. And in terms of the reasons, it varies, and the causes that I mentioned previously, but does not mean that you cannot fall pregnant. And that is the individual that needs to seek help. That is the individual that needs to be investigated. Are we dealing with a physiological problem, or let's just say if it's a man, did they experience trauma during that time from their first pregnancy to trying to conceive now? And then is it a trauma to the genital area? So is it a structural problem? Or did their lifestyle habits change? And are they now overweight? They're no longer exercising, they're drinking, they're smoking, job has changed, so the environment where they work, are there certain environmental factors that render them infertile? So those are the different things. And that's why it's so important that whoever actually is struggling to fall pregnant, there's a history taking process that takes place, and then investigations and examination and investigations to actually find out what the real cause is.
Let's expand a little bit, Doc, in terms of those lifestyle factors. How much of an influence, apart from the blockages and the genetics, does stress and just those environmental exposures play in this infertility that people could experience?
It's really important. I think that's what we ignore, especially in the current times, because someone may argue, but long time ago, everyone was getting pregnant so easily and so forth. And now why are people all of a sudden struggling? So we have to look at what we call endocrine disruptors. So endocrine disruptors is something that basically changes your hormonal milieu, if we put it that way. So where you work, do you work in the mines? Do you work in a place where there's lots of chemicals? What do you eat? Do you exercise? What is your stress levels? Because if you really look at how your body functions as a whole, stress does have an impact. And I know we always speak about stress in terms of how it affects your heart, and you can have a stroke and so forth. But the forgotten part is, does stress affect your fertility? And yes, it does. That time urgent perfectionist syndrome, where we're always in a rush to just get things done, and we don't take a step back and say, wait a minute, let me just relax, let me just work on my mind. And I think that's the whole thing. And that's when we look at infertility, it has such a huge psychological impact. So you've got your work stresses, and then you've got your stresses in terms of I'm struggling to fall pregnant, and all that just impacts and it piles on. And ultimately, it does have some sort of impact on your fertility. I'm not saying it's the only cause, but it's almost an additive effect on top of anything else that you may possibly have. And that's why, sorry, just to add to that,
sure.
and that's why it's so important that, when you do seek fertility treatment, we have a reproductive psychologist that we really recommend couples to go to just deal with those stresses, because that is the one thing that you can't give medicine for stress.
True.
You really can't. So that reproductive specialist really comes into play and is part of the treatment process with regards to treating infertility.
And I can imagine just the family support would also be very vital if someone is going through such. Are there any technological advancements that you're seeing on the horizon that are really assisting in terms of infertility treatments?
Well, look, once someone is diagnosed with infertility, and we go back to the textbook definition in terms of whether you've been trying to fall pregnant for a year, if you less than 35, or 6 months if you're more than 35, then that's where we look at things like IVF and intrauterine insemination, so which is what we specialize in. And that is really assisting the couple to fall pregnant. So just to expand further, with IUI, intrauterine insemination, is an ovulation induction, is where they say a patient now has polycystic ovarian syndrome and they're unable to ovulate and they're having anovulatory cycles. That specific patient, we would give them ovulation induction agents, so to get them to actually ovulate. And you can do timed intercourse. In other words, you really actually prescribe a certain time where the couple should have sex in order to optimize their chances of falling pregnant, or you introduce you deposit the sperm into the woman's female genital tract. Then we've got IVF, where it's really doing the whole process of conception outside of the body, the woman's body, and then introducing the fertilized body embryo into the woman's body, and then by doing that, hoping for a pregnancy. Yeah. So there is look, IVF has been around for years. It's not a new technological phenomenon or anything like that. It's just that now I think it's happening a lot more. There is just more advances in terms of our freezing capabilities. And what I mean about that is that whereas before the freezing capabilities were really poor, now we can freeze embryos, and a woman has reproductive freedom. So now when they're ready to have babies, then they can come back and we can complete the process of IVF by doing an embryo transfer.
Doc, very quickly, we have run out of time. I just want to get your understanding on the equitable access to reproductive health. Do you think it's sufficient in South Africa? Are people having the means to access these services?
I mean, can I just take it outside of Africa? It's a problem globally. It's a problem globally, and that access that you speak about, and when I speak about South Africa, when we look at the private and the public sectors, there's very limited clinics that are available to patients, just from first of all, from let's just look from a province point of view. How many fertility clinics are there? Are they available in every clinic? And are they all accredited clinics? And that's also the other thing that we need to talk about, is that there are clinics that need to be accredited by our body, SASREG. So there's very few in terms of that. But let's take it further to the public sector. Right now, there's only 3 fully functioning fertility clinics in South Africa in terms of the public. We've got 2 in the Western Cape, and then we've got 1 at Steve Biko in Gauteng, at Steve Biko Academic Hospital. So in terms of access, it's not necessarily a South African problem, it is a global problem. At MadeFem Fertility, we get a lot of patients who come in from actually the rest of the world, not just from other provinces in the country, but Africa and Europe and the Americas as well. Right. So access is definitely a global issue, not necessarily a South African issue.
All right, Doc, thank you so much for your time and sharing these insights with us. Certainly, many people have gotten this knowledge when it comes to reproductive health as well as infertility. Thank you for joining us this evening.